Today we're here to talk to Dr. Lee about the chief complaint in neuro-ophthalmology. In medical school, we are taught to put the chief complaint in the patient's words. Often it's in quotation marks. For example, I have eye pain. Dr. Lee, what do you think about this method for chief complaints?
So even though I think there is some rationale and some reason for doing it that way, in a very busy clinic, I prefer to have a focused stem. And by a focused stem, I mean having their age, their gender, the tempo of whatever happened to them in terms of acute, subacute, or chronic, whether it was painless or painful, and then the clinical sign. So, for example, a 20-year-old white female presents with acute unilateral loss of vision, pain with eye movement, a relative afferent pupillary defect, and a normal fundus. That's the stem for optic neuritis. And we can get to that optic neuritis very quickly with a focused chief complaint that incorporates all of the features that I just told you. However, if we were to change the stem to, say, an 80-year-old white female with acute unilateral loss of vision, headache, pain in her jaw, a relative afferent pupillary defect, and a normal fundus, that subtle change in the focused stem creates a different differential diagnosis and leads us towards giant cell arteritis rather than optic neuritis. And so it is that kind of change in terms of the chief complaint that I think is much more valuable to learners, including medical students, than just putting in quotation marks their chief complaint, especially if it's a vague complaint like blurred vision or double vision. Blurred vision could mean cataract, it could mean pituitary apoplexy, it could mean you're going to die in the next 30 minutes. There's no way for us to know from that unfocused stem where we should be focusing our energies and what should we be doing on the exam. So to me, the best chief complaint is a focused stem that allows the listener to already begin to formulate a differential diagnosis from the start, and ideally is sufficiently focused to be able to get to the diagnosis, or at least the top of the differential diagnosis, really quickly. So that's kind of my take on the chief complaint.